Today we can discuss Navodaya female staff nurse memory-based questions part 2. Before that, so many candidates having doubt because they cannot fill online application for the sister grade post for the Sanjay Gandhi Postgraduate Institute Medical Science. For that, the sister grade 2 link is still not activated. You can see here in the website recruitment and admission section. Here you click view all the news and 12 number there is recruitment advertisement for the post of sister grade 2 and technicians, but there is no apply online option is there. There is no apply online. You have to wait for that. I will do a video once the vacancy is activated. Here also no sister grade option is not there. If you are apply online here, there is no sister grade option. Notification video today we can discuss Navodaya female staff nurse memory based questions part 2. How many bones present in human axial skeleton? 80 bones. There are 80 bones present in the human axial skeleton. These bones are within the central core of your body. This includes bones in your skull, cranial and facial bones, ears, neck, back, vertebrae, sacrum and tailbone, and rib cage, sternum and ribs. That means axial skeleton, 80 bones. Axial skeleton means the skeleton within the central core of the body. So repeatedly study this: skull, ear, neck, vertebra and rib cage. Okay, axial skeleton and 80 bones. How many weeks present in development of embryo? 0 to 2 weeks germinal period, 3 to 8 weeks embryonic period, 9 weeks to birth fetal period. Second question. Third question, drug used in ectopic pregnancy. Methotrexate. Methotrexate drug used in ectopic pregnancy. This drug stops cells from growing, which ends the pregnancy. So, pregnancy end cheyan drug methotrexate. Ectopic pregnancy also called extrauterine pregnancy. Next question, main complication of acute renal failure is options: hypernatremia, hyperkalemia, hypophosphatemia, muscle weakness. In this option, main complication of ARF is hyperkalemia. Hyperkalemia is the correct answer. Hyperkalemia. In severe cases, this can lead to muscle weakness, paralysis and heart rhythm problems, fluid in the lungs, pulmonary edema. Next question, olfactory hallucination means abnormal vision, abnormal sensation, abnormal noises hearing, abnormal smell. Olfactory hallucination means abnormal smell. Abnormal smell, that is olfactory hallucination. Tactile hallucination, that is abnormal sensation. Patients is complain sensation complaint tactile hallucination usually drug addict patients. Visual hallucination, abnormal vision. Next question, which organ is mostly affected in malaria? Options: liver, brain, bone marrow, intestine. Malaria, liver is mostly affected. Liver is mostly affected in malaria, and also brain affected. The malaria parasites enter the person's bloodstream and travel to the liver. When the parasites mature, they leave the liver and infect red blood cells. Red blood cells also injured. Next question, the type of diarrhea affected in Crohn's disease is bile salt diarrhea. Bile salt diarrhea, that is a type of diarrhea affected in Crohn's disease. Crohn's disease most often affects the ileum, the lower end of your small intestine. Lower end of your small intestine, ileum is mostly affected. This part usually absorbs bile acids, which your body creates to help it absorb fat. If your body can't process the fat, you could get this type of diarrhea. Oliguria is decreased urine output less than 400 ml daily in adults. That is oliguria, less than 400 ml urine per day. The 5 elements of communications are source, message, channel, receiver, and feedback. The 5 elements of communication are source, message, channel, receiver, and feedback. Drug used for manic disorder is lithium and sodium valproate. Drug used for manic disorder is lithium and sodium valproate. Characteristic green pea soup appearance diarrhea seen in options ulcerative colitis, typhoid, cholera, none. Pea soup diarrhea seen in typhoid. Okay. Green pea soup appearance which is so common in both Salmonella and Shigella infection. Salmonella typhi cause typhoid. Salmonella and Shigella infections usually green pea soup appearance of stool. Rice water stool seen in cholera. Okay, that's it. So already we discussed 30 memory based questions from NVS examinations. If you have any questions in your memory, you can message me through WhatsApp. I will do video. And 2 questions more. I added 2 questions separately. Silent epidemic of the century is options coronary artery disease, chronic liver disease, chronic obstructive lung disease, Alzheimer's disease. Silent epidemic of the century is Alzheimer's disease. Alzheimer's disease is the correct answer. That is a silent epidemic of the century. Coronary artery disease, CAD, cause more death in human. Second question, Bhopal gas tragedy is an example of options point source epidemic, continuous epidemic, propagated epidemic, slow epidemic. Correct answer is point source epidemic. From one source, the continuous outbreak of the problem arriving. So it will take very long time to expose the problem in an area. So that is example of point source epidemic. Continuous epidemic means for prolonged period of time happening. Example, in 1854 there is a cholera outbreak in London. That is a continuous epidemic example. So epidemic happening very slowly over a period of time. Point source means only one point the problem is happening, but continuous epidemic, it is from many sources. Cholera from many sources taking time, it is continuous epidemic. So that's it, today's video. Please share this video to your friends. For PDF you can contact me through WhatsApp. Thank you. All the best.